How is a total IgE test used for allergy diagnosis? Have you ever wondered how doctors figure out if you have allergies? One important tool they use is the total immunoglobulin E test, often referred to as the total IgE test. This blood test measures the overall amount of immunoglobulin E antibodies in your blood. These antibodies are produced by your immune system when it encounters allergens. Allergens can be things like pollen, dust, mold, animal dander, certain foods, or medications that trigger allergic reactions. In a healthy individual, there are usually small amounts of immunoglobulin E present. However, if your levels are elevated, it may indicate that your body is reacting to something it perceives as harmful. This is where the total IgE test comes into play. It provides a general indication of whether your immune system is producing more immunoglobulin E antibodies than normal, suggesting that you might have an allergic condition. It is important to note that the total IgE test is nonspecific. This means it does not tell you which specific allergen is causing your allergy. Because of this limitation, it is often used alongside more specific tests that measure immunoglobulin E antibodies directed against individual allergens. This combination helps doctors pinpoint the exact triggers of your allergic symptoms. The total IgE test is particularly useful in certain situations. For example, if a doctor suspects allergic bronchopulmonary aspergillosis, which is a lung condition caused by a fungus, this test can be helpful. It is also considered when discussing treatment options like omalizumab therapy for asthma. However, it is not recommended as a general screening tool for allergies. A normal total immunoglobulin E level does not rule out an allergy, and elevated levels can occur in other conditions unrelated to allergies. For a thorough allergy diagnosis, the total immunoglobulin E test is combined with specific immunoglobulin E tests. These specific tests measure immunoglobulin E antibodies against particular allergens, allowing for targeted management and treatment. This approach helps ensure that the right steps are taken to address your allergies effectively. In summary, the total immunoglobulin E test is a supportive tool in diagnosing allergies. It indicates overall immunoglobulin E antibody levels, but requires additional specific testing and clinical evaluation to accurately identify and manage allergies.